et toutes. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc. I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, as usual, I would like to remind you to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à temps qu'on vous invite à poser une question. Today, we will be hearing remarks from le maire Jim Watson, followed by Councillor Jenna Sudds, Chair of Community and Protective Services Committee, la conseillère Jenna Sudds, présidente du Comité des services communautaires et de la protection, Councillor Keith Eglai, Chair of Ottawa Public Health Board, le conseiller Keith Eglai, président du Conseil de santé d'Ottawa, and Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media following the statements, we have disponible pour répondre aux questions des médias, nous accueillons aussi Donna Gray, General Manager, Community and Social Services Department, Directrice générale des services sociaux et communautaires, Stephen Willis, General Manager, Planning, Infrastructure and Economic Development, Directeur général de la planification, de l'infrastructure et du développement économique, Dan Chénier, General Manager, Recreation, Cultural and Facility Services, Directeur général des loisirs, de la culture et des installations, Leanne Snedden, Associate General Manager, Emergency and Protective Services, Directrice générale adjointe des services de protection et d'urgence, Pierre Poirier, Manager, Security and Emergency Management, gestionnaire des services de la sécurité et de la gestion des mesures d'urgence, Dean Lett, Director of Long-Term Care, Directeur des soins de longue durée, and lastly, Roger Chapman, Director, Bylaw and Regulatory Services, Directeur des services des règlements municipaux. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Good afternoon, everyone. Bon après-midi, mesdames et messieurs. The past 8 weeks of closures and emergency restrictions and the stay-at-home and physical distancing measures have been difficult for everyone in our city. The restrictions have limited what we can do, how we socialize, and even how we go out for exercise and fresh air. We're all anxious to get back to our regular activities and normal business and normal routines, but we know these measures are in place for the safety of everyone in our community. Physical distancing and avoiding groups have limited the spread of COVID-19 and have prevented deaths, but many families have still lost loved ones. To those who have lost a family member or friend, please know that our hearts and the support of our entire community go out to you during these incredibly sad and difficult times. We are making progress in flattening the curve, and we're taking cautious steps on the path to fully reopening parks, businesses, and the overall economy. Today, I want to speak about our efforts to increase access to parks and green spaces in Ottawa, and also to provide you an update on window visits at the City of Ottawa's 4 long-term care residences. Effective immediately, I'm very pleased to announce that individuals and families can enjoy fresh air and various outdoor activities in all city parks. What this change does allow is for you to go out and enjoy the open green spaces in our city parks. You can let your young ones run around and burn off excess energy, throw or kick a ball or fly a kite. You can sit on the grass or on the lawn, bring your lawn chair to rest, to read, and able to stretch and exercise. Grâce à cette nouvelle directive en vigueur immédiatement, les résidents et leurs familles peuvent profiter des espaces verts et de l'air frais en plus de faire certaines activités à l'extérieur. Everyone must also comply with the current restrictions under the provincial emergency orders, including the prohibition on gatherings of more than 5 people and the use of outdoor recreational amenities. These amenities that fall under the provincial order of what can't be used include benches, play structures, sports fields, off-leash dog parks, and basketball courts in our parks. Municipal boat launches remain closed, and the launching of kayaks and canoes from city beaches and parks is still prohibited under the provincial order. We continue to follow the sage advice and directions of Dr. Vera Etches, our Medical Officer of Health, who's doing a great job during these very difficult times. We've developed guidelines that will allow us to stay vigilant and take a measured approach so that we can keep moving in the right direction. We are allowing greater access to our parks and green spaces, but this is still not full access. We need to be mindful and respectful of the health of others by continuing to practice physical distancing, that 2 meters. Nous devons être attentifs et respectueux de la santé des autres et continuer à maintenir 2 mètres entre nous. COVID-19 is still in our community. The efforts you have all taken up to now have enabled us to loosen some of the restrictions, but we can't let our guard down just yet. I know we're all anxious to get back to our normal routines and our way of life, and this is just one small step in that direction. I want to thank Councillors Eglai and Suds for their work in allowing sections of parks to reopen. In essence, when people are saying, well, what does this mean? Go and enjoy the parks, the green and open space, stay off all of the structures. That's really the bottom line. We want you to go out and have fun, run around the green spaces, the open areas, but please don't go into the children's playground areas or sports fields and the like. Today, I'm also pleased to announce that a plan has been put in place to allow for families to visit their loved ones through windows at the city's 4 long-term care homes. Families are asked to schedule their visits in advance and will be able to do so at set visiting hours from 9:30 to noon, 1:30 to 4:30, and 6:30 to 8:30 p.m. At the agreed upon time, a family's loved one will be brought to a common window and, if possible, given a phone to talk to their family members on the other side of the glass. The health and safety of the residents of our long-term care homes is the #1 priority for our very caring staff at these 4 homes. In essence, it's really 2 homes that have windows at the first level, they being Peter Clark and Carlton Lodge. The other 2 facilities, we don't have residents living on the first floor. La santé et la sécurité des résidents de nos foyers sont la plus grande priorité de notre personnel ici à la Ville d'Ottawa. If the home is experiencing an outbreak, visitors will not be permitted. I'd like to thank our staff for their hard work in finding ways to enable visits while still protecting the safety and well-being of our loved ones in these 4 long-term care homes. We're sending letters to families to inform them of the updated plan. We kindly ask that you contact the home in advance to schedule an appointment for a visit with a loved one. A memo to council outlining these changes will go out shortly after this news conference. And with Mother's Day right around the corner, I hope this gives families a chance to see their mothers, grandmothers, and even great-grandmothers in the comfort of their home while you're on the other side of the glass. Thank you. Merci beaucoup.
Thank you, Mr. Mayor. We will now hear from Councillor Suds.
There we go. Thank you, Mayor Watson, and good afternoon, everyone. Bon après-midi tout le monde. We continue to support businesses in the community facing challenges and barriers throughout these difficult times. We are focused on economic support and recovery as a critical part of our COVID-19 pandemic response. We're committed to working with economic development partners to help our restaurants and small business owners get through this pandemic. I want to thank Mayor Watson, Councillors Eli El-Shantiri and Laura Dudas, members of the Economic Partners Task Force, and our city staff for working with the Ottawa business community to support our local businesses. At our last council meeting, I asked city staff to explore using the Innovation Pilot Program to challenge the local technology community to bring forward innovations and solutions that would support the city's recovery efforts. They have worked incredibly fast, including consulting with our business community as they crafted this challenge, showing how committed we are as a city to working with our business community. Today, I'm thrilled to share that the City of Ottawa is extending a challenge to our business community, a challenge to send us your proposals for technology innovations that will help accelerate Ottawa's ability to get the workforce back to work and to safely resume business operations. I know our business community is up for the challenge. We have Canada's largest technology park right here in our city, and we are truly a city of innovators. We have already seen firsthand how many companies have pivoted to help support the COVID-19 response. I know in the months ahead, the gradual easing of the pandemic restrictions will bring new challenges for our community and our businesses. When our local stores start to reopen, it will be challenging, and we will need new ideas and approaches to help our economy bounce back while keeping people safe. The city's innovation pilot program and the new recovery stream is seeking innovative project ideas to support public health efforts to stimulate economic recovery. Examples include how to innovate diagnostic tests, screenings, cleaning protocols, or remote operations, online business, and virtual work. We are accepting proposals for solutions for many sectors, including health, tourism, festivals and events, restaurants, retail, construction, transportation, and food supply. Successful applicants will have the opportunity to test and quickly deploy their technology innovations in real-life testing environments with the city or one of our economic development partners. This program provides companies with valuable feedback on their innovations prior to scaling and production. We're accepting these proposals starting today until Wednesday, May 20th of this year. You can check on the website ottawa.ca for more details and eligibility criteria. Nous accepterons nos propositions jusqu'au mercredi 20 mai 2020. Vous les consultez ottawa.ca pour plus de détails et les critères d'admissibilité. I'm proud of our city's work on the Economic Partners Task Force, and I'm proud of the countless partners who have stepped up to provide support for those in our community. Je suis fière du travail accompli par le groupe de travail des partenaires économiques et des affaires continues de nos partenaires. With respect to the mayor's comments on access to city parks, I do want to remind people to limit your activities in our parks to members of your own household. It is important to maintain physical distance of at least 2 meters from non-household members during these activities to ensure we limit the spread of COVID-19. And I want to remind residents that if you are not with members of your own family, the provincial orders do restrict gatherings of more than 5 people. The orders continue to prohibit the use of our sports fields and courts, such as football and soccer fields, baseball diamonds, tennis courts, basketball courts, and also does not allow for organized sports of any kind. So this also applies to our skate parks, our play structures or playgrounds, swings, benches, picnic tables, and off-leash dog areas. I also want to mention that our parks and recreation staff, along with emergency and protective services and Ottawa Public Health, are also working on preparations for anticipated changes to park restrictions from the provincial government. So there is more to come, but we do need to remember to continue physical distancing as we reopen elements of our parks. I also want to take the opportunity to acknowledge and thank all frontline staff in the Community and Social Services portfolio who have been so dedicated in helping others, including our wonderful staff in the long-term care and our dedicated officers and paramedics. Thank you all. Merci beaucoup.
Thank you very much, Chair Suds. We will now hear from Chair Eglai.
Thank you. Hello, bonjour, Quay. It gives me great pleasure to speak today to the news that the City of Ottawa will permit the limited use of green spaces in our city parks. While we can't yet use sports fields and basketball courts, I do encourage members of the same household and individuals of up to 5 people who are physically distancing to play catch, kick a soccer ball, let children run off some energy, or simply enjoy the warmer weather while sitting on the grass. This is exciting news, but please remember that physical distancing guidelines remain critical. These guidelines are in place to ensure the safety of our community and are an integral part of getting through this pandemic as quickly and as healthily as possible. When venturing outdoors, please continue to maintain your 2-meter distance. Perhaps consider changing your walking or running route or time of day to ensure that you can safely follow these guidelines. And please, under any circumstances, do not spit in a public place. Spitting is not only an unpleasant thing to do, but it is also dangerous for others, as saliva is one of the main ways this virus is transmitted. As all of us venture out more, I encourage you to wear a non-medical mask when out and about, particularly when in a situation when physical distancing is difficult to maintain, such as at a grocery store. Mask wearing is not a substitute for physical distancing and hand washing. However, it is an additional measure to protect others, even if you have no symptoms. To learn more about masks, please be sure to visit the Ottawa Public Health website for guidance on the proper wearing and use of these masks, as improper use can increase your risk of exposure. Also, please remember that medical masks, including surgical, medical procedure face masks, and respirators like N95 masks must be kept for healthcare workers and others providing direct care to COVID-19 patients. Lastly, I would like to thank the province of Ontario and our local members of parliament for taking action and local members of provincial parliament for taking action in opening the outdoor allotment gardens and community gardens in time for the spring planting season. These gardens are an excellent community resource for local and sustainable produce, in addition to providing opportunities for fresh air and physical activity. Public health recommendations for garden coordinators as well as gardeners can be found on the OPH website. OPH is working closely with partners to ensure these valuable community resources are used safely and responsibly. Thank you for everything and you are doing to help us fight COVID-19 and to help us to remain a strong and resilient community. Thank you.
Thank you very much, Chair Eglai. We will now hear from Dr. Etches.
All right, bonjour, good afternoon, everyone. Trying to sort of move these things so I can see everything. Thank you. I do want to recognize that the Ottawa communities come together and shown great support for each other through the pandemic response, and that this week is National Mental Health Week. It's an annual event, but I think we can appreciate the importance of mental health even more during these times. The message this year is about being honest and being clear about our needs. And so that helps us then know how to support each other and get help when we need it. J'aimerais souligner que c'est la Semaine de la santé mentale, un événement annuel pour reconnaître l'importance de la sensibilisation à la santé mentale au Canada. Et face à la pandémie de la COVID-19, nous avons besoin les uns des autres encore plus qu'auparavant. Être honnête et clair au sujet de nos besoins et en ce qui concerne notre santé mentale est important, afin que nous puissions continuer à nous soutenir mutuellement. So there are resources on the Ottawa Public Health website that you can use to support your family, your friends, your colleagues, or yourself. I shared last week that Ottawa Public Health is transitioning to a new case management and reporting system. So in the interim, we have a condensed epidemiological report on our website. And we do appreciate your patience as people would like to have all of the numbers that they're used to. We will get there very shortly. What is important to highlight regarding the data that gives us an idea of infection in the community is that the level of hospitalizations is not in steep decline. Ce qui est important de souligner concernant les données que nous donnent une idée de l'infection dans notre communauté, c'est que le niveau des hospitalisations n'est pas en forte baisse. So this means we've had success in planking the curve, but we need to keep remembering that the level of infection in our community is simply being kept at a manageable level. There continues to be a risk that as we increase our interactions with others, that the level of infection in the community can again quickly rise. Somebody, not myself, because I'm not a wrestler, but was describing to me that we've kind of wrestled the level of COVID infection to the ground. And we need to make sure that we continue to have measures in place that keep that infection pinned down. So one of the measures is testing for COVID and following up with cases. And wanted to highlight that the surveillance testing that's being done by for residents and staff in long-term care homes is well underway. There are 28 long-term care homes in Ottawa, and 15 of them have had that testing completed. This means that we are on schedule or ahead of schedule to finish all of the testing by the provincial deadline of May 15th. We've tested over 1,800 residents and 1,800 staff, and there are results pending from multiple homes. This is a work that's been possible with the collaborative effort of many different partners, the long-term care homes themselves, the Champlain Health Region Incident Command, the local hospitals, the Eastern Ontario Laboratory Association, the Public Health Ontario Laboratory in Ottawa, Ottawa Paramedic Services, and our Ottawa Public Health team members. So with all of the interest in testing, it is important to place surveillance testing in the overall context of controlling transmission of the disease. The surveillance testing will give us a snapshot at one point in time of the infections in long-term care homes. What we have been seeing to date is that the homes that are the worst affected do have higher levels of infection that are showing up, but the homes that are not in outbreak, that are undergoing the surveillance testing, are not finding large numbers of asymptomatic residents or healthcare workers affected. That is good news that we need to continue to focus on employees avoiding work if they're symptomatic, ensuring that all employees wear a medical grade face mask at all times when they're in the workplace, and making sure that people who are infected are cohorted to keep those with infection away from others. I am also wanting to continue to highlight for people over 60 in Ottawa that we have expanded your ability to access assessment for COVID-19 testing if you have symptoms that could be compatible with COVID-19. So when it comes to community engagement and getting ideas about the relaxation of restrictions, more than 8,500 people have visited the Engage Ottawa platform. Over 1,200 people have participated in a survey on that platform, and we're receiving many ideas about how to make physical distancing more manageable. J'ai le plaisir de vous annoncer que notre sondage sur la participation à la lutte contre la COVID-19 a suscité près de 8 500 visites sur la plateforme, que 200 utilisateurs ont répondu au sondage et que nous avons reçu plus que 115 idées sur la façon de rendre à la sur la façon de rendre la distanciation physique plus facile à gérer. So from what we've heard so far, the restrictions that have been especially difficult for residents include the closure of parks, reduced family and social connectedness, physical distancing requirements, and the closing of schools and daycares. So residents are encouraged to continue to visit Engage Ottawa, engage.ottawa.ca/COVID-19 to complete the survey in English or in French and provide us our feedback. This will help us adjust the recovery plans to meet the needs of our community as much as possible. So there have been questions about masks as well over the past few days and as part of our recovery plan. You might be seeing more people wearing masks in the community. Someone wearing a mask is sending a signal that they care for you. Quelqu'un qui porte un masque envoie le signal qu'il se préoccupe de vous. the idea is they're protecting you from their respiratory secretions. And so, again, because of the risk of rising rates of infection returning, Ottawa Public Health recommends that residents continue to practice physical distancing of 2 meters from others and to wear a non-medical mask when this distance cannot be maintained. And that could be such as on public transit or at a grocery store. And thus, this will help decrease transmission of COVID-19. SPO recommande aux résidents de continuer de maintenir une distance physique de 2 mètres avec les autres, ainsi que de porter un masque non médical lorsqu'il est impossible de respecter cette distance, comme dans les transports en commun ou à l'épicerie, afin de réduire la transmission de la COVID-19. So for more information about non-medical masks, including how to make one or where to buy one, please visit our special masks website at ottawapublichealth.ca/masks. So we do know COVID-19 is circulating in our community and transmission can occur when a person's asymptomatic. Wearing this non-medical mask is not a replacement for the physical distancing, still remembering to hand wash and monitor our health. Thank you for people, all of you who are listening, doing your part. You are making a difference. Physical distancing is working. We just can't let it up. Limiting outings to essential trips only is working, and we need to continue to do these things so that we can be confident as we move forward with relaxing current restrictions. We will get through this together. We want to stay connected. If we can't be physically connected, reach out to people around you in other ways. Thank you. Merci.
Thank you, Dr. Etches. I will now invite questions from each agency alphabetically. You may ask one question and one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we'll begin with Chris Curries at 1310 News.
Good afternoon, everyone. The restrictions in parks are now being loosened so people can go kick a ball, things like that. How do you prevent people from, if you're giving them an inch, then they're going to take a mile?
Well, I think the fact is that we've seen great compliance over the last couple of weeks in our parks. People are respecting the rules, staying off the playground equipment and the basketball courts and so on. And I think people understand that we're able to do this because we've had great cooperation from the public over the last couple of weeks. So I have confidence that people will not abuse the situation because, we've heard loud and clear from constituents over the last little while that they really do want to have some access to the vast amount of green and open space that's connected with a park. As you know, most of our parks would have a playground structure, and then the rest would be green grass and paths and so on. So what we're telling people is that we still have to follow the provincial rules. You can't go on sports fields, for instance, but you're more than welcome to go and have a picnic or toss a football or a soccer ball around on the green open space that's attached to every park in the city.
And just to follow up for you, and also I'd love to get to Roger Chapman's thoughts from bylaw. Will enforcement need to be increased so that people don't take advantage?
Well, I'll let Roger speak about the logistics of that. But again, we do have regular patrols of our parks from bylaw officers, but I don't anticipate any stepped up enforcement. The reality is that we've seen great compliance over the last couple of weeks and fewer warnings and tickets that have been issued. And that's a tribute, I think, to the public who understand that we're still in the midst of this COVID-19 serious health situation. And what we wanted to try to do was to do what we could within our realm of responsibility to open up those parks so that people, particularly with kids, and particularly those who don't have a backyard or living in an apartment, have an opportunity to go and run around, have a picnic, do yoga, fly a kite, and do fun things like
Yeah, and sorry, it's Roger here. Yeah, and I can't agree more. At this point, we're not contemplating adding any additional resources to the existing team. I can say that we've done in excess of 10,000 proactive inspections in parks, and we've had an overwhelming positive response from the general public. And it's only resulted in 117 charges. So I think that truly reflects the response from the public. And I think in well over 95%, we're getting compliance in the park. So I don't anticipate that changing.
Thank you.
Thank you very much. Moving on, we will go to Joanne Chianello at CBC.
Hi, thanks. And the park openings will be very welcome news, but I've already gotten a few confused people tweeting at me. So I'm wondering if you can talk a little bit more, anyone who needs to talk about that, about whether it's the difference between a green space and a field. So yes, you can kick a soccer ball around, but if you're kicking a soccer ball around on a soccer field, even if it's not an organized sport, is that allowed? Like, can you just sort of parse out exactly a little bit more exactly what's going to be allowed? Because I think there's going to be a lot of questions about that.
Yeah, I can comment on that, Joanne. Soccer fields, football fields that are set up for that specific purpose, people know what they are versus just an open green field. The province has indicated that we cannot allow people onto sports fields. So if you look at, for instance, Brewer Park is a good example. Brewer Park, the vast majority of Brewer Park is green space, but there's a baseball diamond. So that's the organized sports field. You can't go on the baseball diamond, but you can use all of the rest of the space at Brewer Park, which is off Bronson Avenue. You just can't go and use the baseball diamond, and you can't use the children's play equipment. So what we've tried to do is make the message as simple as possible. If you want to go and enjoy, whether it's flying a kite or tossing a frisbee around or having a picnic or doing yoga, feel free to do it. Respect the 2-meter distance, but please don't go and allow your kids to go on the swings and the monkey bars and so on, because those are still covered under the provincial regulation.
Right, as are the rules about not being in a group of more than 5 people.
That's correct.
Okay.
And I think it's, as Jenna said, I think it was Jenna or Keith, you can go and toss, a football around or kick a soccer ball. You just can't go and organize a game because that would be more than 5 people. So I think what we've tried to do is make it as reasonable as possible, given the constraints we have by the province.
Okay, thanks very much. And then my second question I have on whoever would like to answer, probably the mayor and other people as well, about the province's opening up of retail stores to curbside business. How would that work in Ottawa? Are you looking for just comments on sort of how you feel about it from a city point of view, also a public health point of view? Thank you.
Well, maybe I'll begin and ask Vera to comment as well. Look, some businesses will do well with curbside delivery. They have the mechanism in place. They have social media and a website that people can shop and then have the product dropped off at their car, or they can pick it up if they're cycling or whatever. It does allow more businesses to open and allows more people to come back to work. I'm just not entirely sure myself what kind of take up is going to occur, because I want to be able to see a product. I'm not going to go and buy a suit and not have it fitted and pick it up at the curb of the driveway. So I think it's a bit of a work in progress. Some businesses will probably do well. I know we've seen a lot of curbside business with the food industry, for instance, and catering business that's worked really well. Other stores, not so sure, but time will tell. Vera, I don't know if you have any comments.
No, it's a lower risk activity if people aren't in a confined space coming into contact with each other. So I appreciate that the province is moving ahead with lower risk activity at this point, and we need to monitor the impact of these activities on the rate of infection in our community. So if people have questions about how to operate a business safely, Ottawa Public Health is happy to discuss that with businesses.
Thank you very much. We will move on to Josh Pringle at CTV Ottawa.
Thank you very much. My question, I guess, would be for the mayor, but maybe for Ottawa Public Health. Did the NCC's success with the pilot project on Queen Elizabeth Driveway make it easier to decide to open up the more green space for residents? Did that have any play in the decision?
Josh, not really. We were operating based on the land that we have responsibility for. My understanding is the NCC extended the period of time for the driveway, which is great because I think they needed more time to analyze whether it's working well and working up to the expectations that they had set. So we were very much working on the property that we own. We've had some questions, for instance, on Twitter, Joanne referenced this just a moment ago, about places like the Arboretum and Experimental Farm. As you know, those are federal lands. We have no jurisdiction over those lands. So whatever their rules and regulations are with respect to accessing those, if they're going to change, will have to come from the federal government because we don't have that authority. We can only have jurisdiction over the parks, the city parks that we run and operate.
And I don't have anything to add.
Okay. My follow-up question, we're getting a few comments already from dog owners, especially at work as well. Why not open up dog parks? What's the risk in not allowing dog parks to open as well?
I wish we could, because I know the dog parks are really popular. The one that's in Kitchissippi Ward, and I know the one, I think my one claim to fame on dogs was I opened the first dog run in the city of Ottawa at Sylvia Holden Park at Lansdowne. But that is covered under provincial regulation. I'm not quite sure why. We're working with the province to see if we can't loosen up some of these restrictions, because I think dogs need exercise as well as kids, and it would be great that those dog parks are open. Those parks, the city parks that allow dogs on leashes, of course, can now come and go to those parks. But unfortunately, because the province has dictated that we cannot open dog parks, we're not able to, but we put in a pitch to the province that's one of the, I think, good examples of where I think we should be more reasonable.
Thank you very much. Moving on, on cède la place à Julien Paquette, Le Droit.
Oui, bon, aujourd'hui, deux députés de la région qui ont demandé au gouvernement provincial d'intervenir directement dans une résidence privée du secteur Orléans, Madonna Care Community. Je ne sais pas, Mme Etches, Dr. Etches, si vous avez des données ou de l'information concernant la situation qu'ils signalent là-bas, notamment la pénurie de main-d'œuvre et un non-respect des protocoles pour le port d'équipements de protection?
J'apprécie, il y a concern pour les résidents qui habitent à la Madonna Care Community. Et c'est aussi important pour nous et le système de la santé d'aider. C'était une maison, un foyer de soins de longue durée où il y a une priorité depuis longtemps d'aider avec le nombre des employés qui peut être là, aussi la provision des équipements. Et maintenant, c'est vraiment plus, il y a beaucoup plus de soutien avec un partenariat avec le système des hôpitaux. Alors, c'est pas comme auparavant, quand c'était juste la maison seule. Mais oui, je comprends, il y a une lettre avec une demande, mais aussi il y a soutien en place maintenant. Concernant les normes, les chiffres dans la maison, on peut déterminer si vous avez besoin de normes spécifiques, mais c'est pas un bon résultat d'avoir un grand nombre de décès comme maintenant. On continue de travailler avec d'autres partenaires d'aider la maison.
Parfait. Puis, concernant les protocoles pour le port d'équipements de protection à cette... je ne sais pas si vous l'avez lu, la lettre des députés, là, mais ils signalent une situation où, par exemple, on recommande, une infirmière dit qu'on lui a recommandé de ne pas changer de masque de protection après avoir traité des patients atteints de la COVID. Est-ce que vous avez entendu parler de ça? Ou?
Moi, je n'ai pas vu des actions des employés dans les maisons, mais il y a des employés d'un hôpital qui est là maintenant et les gens qui aident chaque jour avec l'utilisation d'équipements. Alors, peut-être c'était une histoire d'auparavant, mais je pense que la situation a changé.
Merci beaucoup.
Merci, Julien. Moving on, we will go to Sue Sharing for questions. Okay, I don't see Sue Sharing on this call, so we will move on to Taylor Blewett at Ottawa Citizen.
Hi, this question is for Dr. Etches. Yesterday, we heard the Premier really call out a number of medical officers of health for, in his words, failing to, facilitate adequate volumes of testing in their regions. Do you feel you're among this group that the Premier has expressed disappointment with? And do you have any kind of response to his comments yesterday? Particularly the suggestion that certain medical officers aren't putting in the work when it comes to testing?
Ottawa Public Health is working with our partners, a long list of healthcare partners and laboratories and paramedics who are making the testing happen in our community. We are on target to have all of the long-term care homes completed by, before the deadline given by the province. We've reached over half of them now. So, I think we want to continue to increase testing in many fronts, and we'll move on. We are moving on already to retirement homes. And we have also, this last week opened up testing as a possibility for more of the population. Anyone over age 60, who may have symptoms of COVID-19. So I think it takes a little bit of time, perhaps, for the population to realize, while we've previously had to focus on the priority groups mentioned by the province, the healthcare workers, the essential workers, we're going beyond that now. And we would like people who think they have COVID-19 infection to present for testing.
If I could just offer a comment, I'm not sure who the Premier was referring to, but certainly anyone who has worked closely with Dr. Etches, as I have, and certainly Keith Eglai, knows the dedication and commitment and passion she's brought to this challenge of COVID-19. And her entire staff, they're working around the clock to do whatever they can to minimize injury and death and people contracting COVID-19. So, I'm not sure, again, where the context of that statement came from, but I can certainly tell you my experience has been working with Dr. Etches over the course of the last 8 weeks has been one of great sense of pride in the work that she has done. And she never wants praise, but she deserves praise for a job very well done. We're very proud of her and the team that she's put together.
If I can just add quickly, as the chair, the whole team at Public Health has been flat out since the beginning of this they have been doing, working with all the stakeholders in the city, all the partners, different levels of government. They don't seem to rest. They don't seem to sit down and put their feet up at any time during this, not during the week, not on weekends. I echo the mayor's comments. It's been one of my proudest moments to chair the board and see the great work that public health is doing each and every day, and especially in the response to COVID. And I think we are where we are in the city right now in terms of flattening that curve because of the great work that's been done by public health.
And just as a kind of a specific follow-up, because we don't have this data right now, what kind of testing volumes are we actually looking at, like on a daily basis in Ottawa? And how has this really evolved for us since the beginning of the pandemic? Dr. Etches, if you can just provide like kind of high level, bit of a ballpark, how many are we doing now? How many were we doing like a month ago? Just kind of that type of thing.
Yeah, sure. We can look into the historical data for you. But initially we had no labs. We had zero, and that actually might have been a month ago. Zero testing happening in Ottawa. Then we had one lab, the Public Health Ontario lab, open and doing the COVID-19 testing, and then the Eastern Ontario Regional Laboratory Association has added testing. And so I think we're also expanding now into private laboratories. So there are private laboratories in the region also starting to add their tests. So collectively, that capacity has grown. So previously, we had to focus just on hospitalized patients, on people in long-term care and healthcare workers, and now we're able to go beyond that. We've progressively been trying to advertise that if you're not just a healthcare worker, if you live with a healthcare worker. And now, as I say, we're up to being able to say to the general public over age 60, if you think you have COVID-19, come for assessment. So the capacity is growing across the province, including here. And what we want to do is make sure that as we have increased capacity, we're making use of that capacity. It is a priority for us, just like for the Premier. We do want to see our testing capacity used. And so, appreciate the role of the media to get that message out and help us encourage people to understand that there is COVID-19 infection in the community. It could be you. And if you're over 60, come for assessment.
Thank you very much. Moving on, we will go to John Willing at Ottawa Sun.
Hi, it's a question for Dr. Etches. Doctor, I'm wondering if Ottawa Public Health originally recommended the complete closure of municipal parks, and if so, what has changed now to suggest that they can be reopened?
So I think this takes us back to the last week of March. And we were seeing, we had acknowledged there was community spread of infection in the community. We were seeing the number of cases go up. And we were looking around at what was happening across the province, across the world, and understanding that play structures are something that are impossible to sanitize, that young children, find it very difficult, of course, to keep their hands out of their mouth, to keep their hands clean. And so, my priority was around play structures and making sure that children, would not come in contact with the infection. And it was a hard decision because parks and play structures are very important for families. So we talked it over as a city senior leadership team about the best way to proceed to protect the population. And, I think today what's different is we have moved into a time of trying to live with this virus, that we've managed to keep the level of infection at a place that we can handle in our healthcare system. And so now we need to have, other resumption of activities that make our lives more livable. And so I think the the idea that we need to have a balance and the messaging that we've heard from the community that the parks in particular, the use of the green space is important for mental health. I think we need to listen.
Thanks, Doctor. And by way of follow-up, I guess I would just ask, you mentioned in your comments just there about your concern about play structures specifically, but was OPH supportive of the city closing everything around play structures as well at the time?
So I think, yeah, it's not a simple thing, right? The parks are different pieces of parks, and you saw the provincial order came down a few days after the city closed the parks. There's lots of amenities in parks, lots of things that can cause risk of transmission, and so it was a collective decision to close the parks.
Thanks, Doctor.
Thank you very much. We will now go to Radio-Canada. Gilles Taillon.
Oui, allô? Vous m'entendez?
Oui.
Oui, parfait. Alors, bonjour tout le monde. Et ma question s'adresse au Dr. Etches. Vous y avez répondu en anglais, mais effectivement, hier, le premier ministre Ford avait pointé du doigt 17 des 34 médecins hygiénistes de la province en disant que le nombre de tests quotidiens est inférieur aux objectifs du gouvernement. Aujourd'hui, il est un peu revenu à la charge en disant que c'était son travail finalement de faire pression sur le système de santé. Alors, j'aimerais savoir comment vous vous sentez par rapport à ces propos-là de M. Ford.
Je comprends le concern pour notre maison, notre foyer de soins de longue durée. Je comprends, tout le monde veut avoir tous les dépistages complets maintenant, hier. Je comprends et je peux dire pour Ottawa, c'est une priorité et nous travaillons avec nos partenaires de compléter la tâche avant la période déterminée par la province. Nous avons complété plus que 50% maintenant. Alors, je continue le processus avec nos partenaires.
Ma deuxième question s'adresse au maire Watson. Monsieur le maire, le Québec comment dire, éliminer ou va éliminer progressivement tous ces barrages routiers, sauf entre Ottawa et Gatineau. On dit que c'est parce qu'il y a plus de cas à Ottawa. Ottawa est une région à risque. J'aimerais vous entendre là-dessus.
Bien, il y a plus des risques dans la ville de Montréal et les résidents de Montréal vont visiter Gatineau. Comme j'ai dit, il y a beaucoup de temps, Gilles. Je ne pense pas que ça, c'est une bonne idée, mais je respecte que la ville de Gatineau et la province du Québec avaient le droit de faire les checkpoints à leur côté de la pont. Comme j'ai dit il y a quelques jours, ce n'est pas une priorité pour nous autres à cette côté de la rivière. Et je parlais avec notre chef de police, Peter Slowly, qui dit que ce n'est pas une bonne utilisation des ressources humaines pour les agents de police de faire ça à notre côté de la frontière.
OK, merci.
Seulement 2 questions pour Gilles Taillon, cette histoire.
Ah, mais qui me tient en laisse, vous savez.
Merci, Gilles.
Salut, man.
Maintenant, nous irons à TVA. Kenza, est-ce qu'on a quelqu'un de TVA ou Kenza Beladi? Okay, so we will go last but not least to Pat Ugochioni, your community voice.
My question is for Dr. Etches. With the public and families being isolated for about 7 weeks now, what concern do you have that with the relaxation of the parks, that extended families might meet up in the parks? You've talked a lot about keeping in your bubble with immediate family, but do you have any concerns that someone that hasn't seen grandma and grandpa for 7 weeks might meet up in the park?
I always have to look at what people have done so far. And what people have done so far is protect each other by carrying out physical distancing, staying 2 meters apart, staying home except for essential reasons, and protecting people over 70 by helping people over 70 stay home as much as possible as well. And so I think people have been motivated by protecting others, by caring for others, and I expect that will continue. I think people need information to inform their decisions, and so we want to be clear that the risk in our community has not disappeared, and we do need to continue to protect each other by not gathering outside of our household as much as possible. And that does mean grandparents should still stay away from their grandchildren as much as possible. We know there are different situations where families have to make decisions for different reasons, but this continues to be the most protective way forward, and we'll have to monitor and see if people need help. Understanding the rationale, will continue to try to get the message across in different ways. We're working with partners like the Council on Aging, others who have connections into older adults to help reinforce that they are a population at greater risk of negative outcomes, and we want to make sure that they're protected.
Apart from the family bubble is more than grandma and grandpa, can you say when some of the rules might be relaxed around boyfriends and girlfriends and same-sex partners and whatnot being able to see each other that have been separated? Can you see where that bubble might get relaxed at any point?
Everyone's having to make their decisions about the risk of transmission, and in terms of what is an essential activity, and social support is one of those things we all need, right? So we're still saying if you can manage virtually, that's the safest. And every action that brings people in contact with someone else can increase the risk of transmission if you're within 2 meters. So just to weigh that risk, take informed decisions, keep in mind the protection of others.
Thank you very much. Merci beaucoup. This is all the time that we have today. C'est tout le temps que nous disposons. Wishing everybody a great day. Bonne journée à tous.
Thank you. Bye.